An Ontario nurse fights for informed consent during the height of the pandemic, and she pays for her efforts by finding herself unable to earn a living thanks to restrictions imposed on her for her actions. Well, that, my friends, is going to be the topic of today's show. And so from Trial Site News, I am Adrian, and our episode is starting right now. So, a licensed practicing nurse in Ontario, Canada, Melissa Dorr, showed an initiative and commitment to not only patient health, but also an awareness of ethics and informed consent principles that is above the ordinary healthcare professional, especially in the age of COVID-19. She took the initiative to educate the public about the COVID-19 vaccines, the benefits, and the potential risks, imparting knowledge on ways to seek an exemption where and whenever possible. The nurse only used materials authorized, such as data from the Pfizer and Moderna COVID-19 vaccine monographs, as well as processes and information from the Directive 6 of the Ontario's Public Hospital associated with the Public Hospital Act for the Canadian province. Now, her reasons for doing so was her growing concern about an ever-increasing coercion to pressure Ontario residents to get vaccinated, even when they had concerns for their health and demands for informed consent. By September 2021, Melissa Dorr, who was a practicing nurse at a Mayo clinic, was approached by a former patient who was being faced with workplace COVID-19 vaccine mandates. He was reluctant to take the vaccine as he had several anaphylactic allergies and health conditions. Apparently, he had tried reaching out to a family physician for a medical exemption to the COVID-19 vaccine and was told by this medical professional that, quote, he was the problem, suggesting that his reluctance to take the vaccine was prolonging the pandemic, which frankly is sickening and outrageous, and sadly, not entirely unheard of in the age of the pandemic. Anyway, Nurse Dorr told Trial Site News founder Daniel O'Connor that she, quote, found his doctor's response to be unacceptable. So I set out to see if there was a way I could help this patient. I did an online search and came across Directive 6, a document put out by Dr. Kieran Moore, the Chief Medical Officer of Health, intended to guide those who employ healthcare providers, such as hospitals, midwives, ambulance attendants, etc., while implementing the COVID-19 vaccine mandates. So let's talk about Directive 6. Melissa Dorr told us that she recalled her training with the Directive 6 in the province of Ontario. And among other things, Directive 6 for public hospitals within the meaning of the Public Hospitals Act sets forth potential exemptions to the COVID-19 vaccine for healthcare workers. Essentially, the document stated that employers could offer their employees 3 possible options to be compliant with the COVID-19 vaccine mandates. Those options were as follows. First, you could provide proof of full vaccination to COVID-19. Or, second, you could provide a medical exemption to the COVID-19 vaccines. Or third and finally, provide proof of attending an education session that outlined how COVID-19 vaccines work, vaccine safety related to the development of COVID-19 vaccinations, the benefits of vaccination against COVID-19, the risks of not being vaccinated against COVID-19, and the possible side effects of COVID-19 vaccination before declining the vaccine. Now, importantly, and as Dr. Moore had pointed out, organizations have the right to remove option 3, leaving only options 1 and 2 available. For option 2, to obtain a medical exemption in Ontario, the healthcare worker must either receive the vaccine and report a reaction, or they must document a known allergy against the ingredients of the existing mRNA vaccines. And given the newness of these vaccines, the latter requirement would be quite difficult to meet. As Nurse Dorr pointed out to us in our conversation with her, she said they essentially make it nearly impossible to get an exemption to the COVID-19 vaccine. Now, while the Ministry of Health in Ontario acknowledged in the directive the right to informed consent, Ms. Dorr decided to provide an informed consent online education class for those interested. And as a licensed nurse provider in Canada, she had the right to do such an offering on her own time. In our conversation with Melissa Dorr, she told us that what I did was develop a program accessible via scheduled Zoom sessions outlining what the Ministry of Health required people to learn about the COVID-19 vaccine before declining. I used the Pfizer, BioNTech, and Moderna COVID-19 vaccine product monographs as the references to build my presentation. People attended my 40 to 60-minute Zoom session free of charge. Once they received the information and decided they did not want the COVID-19 vaccine, I issued a certificate stating that I taught them the information and that, as a result, they are choosing to decline the COVID-19 vaccine. I did charge $100 for the letter, but made sure individuals knew that financial limitations would not be a barrier for obtaining a letter. Now, suffice it to say, these Zoom sessions were huge, with over 1,500 participants in just a couple of sessions. As a result of her educating people about informed consent, and despite the fact that she was a licensed nurse granted the right to do so, she started to receive serious pressure from the College of Nurses of Ontario, otherwise known as the CNO. By November of 2021, Dorr began receiving correspondences from the CNO, informing her that they were investigating her practice. As she told Trial Site News, I was fully prepared for this. I figured that they would investigate and see that I was doing nothing but basically reading the COVID-19 vaccine product monographs to individuals who were interested in the information and providing them with a letter to act as proof that the education was received, as well as to communicate their choice to decline the vaccine based on the information received. I did not stop providing the classes despite the CNO's investigation. Unfortunately for Melissa, matters escalated, and her employer, Oakwood Health Network, would eventually terminate her employment as health director by December of 2021. Apparently, having a licensed, registered nurse educating the public about informed consent rights associated with the COVID-19 vaccines was just too much for her employer. And what do you suppose the reason given? According to Melissa, it was that her practice of providing informed consent was at odds with a mission to vaccinate everyone. And then on February 7th of 2022, things escalated. The CNO placed restrictions on Dorr's license, limiting her right to practice in the province. She now could only work as a nurse if under supervision by a member of the CNO to perform all nursing acts, along with other terms and conditions. According to Melissa Dorr, the CNO was well aware at the time that I was not employed, as I was fired from my position as a medical director at a men's sexual health clinic in December of 2021 for providing this COVID-19 vaccine education to the public on my own personal time, as the owners of the men's sexual health clinic stance were that everyone eligible for the COVID-19 vaccine should take it as it is safe and effective. Although they respected my choice not to be vaccinated and allowed me to test weekly, they did not align with my providing the COVID-19 vaccine education service to the public and therefore ended our professional partnership. Since February of 2022, I have had these restrictions placed on my license, and as you can imagine, no employer will hire someone who requires supervision to practice and who has an ongoing discipline process with the CNO. Now, as we here at Trial Site News have chronicled, across the United States, licensed medical and nursing providers that deviated in any way from the mass vaccination scheme were economically punished for their actions, and up in Ontario, it appears that there was just more of the same. This, my friends, is how authorities and the medical establishment have maintained control and order to force vaccination. Essentially, the policies that they enforce with an iron fist have led to a universal vaccination policy that, simply put, means get vaccinated or else face financial ruin. As Melissa Dorr told us, she said, "I have not been able to earn a living for the past 14 months due to CNO's restrictions. I received no warning prior to them placing these restrictions. I was never asked to stop offering the course while they investigated. There has never been any question about my nursing practice outside of providing these letters, so I'm not sure why I need supervision to represent myself as a nurse." Now back to the start of the pandemic. Dorr said that she was aware that something was off by April of 2020. At the time, she was working at a family health team, and she tried to share her concerns with her colleagues, but any expressed unease about how the pandemic was unfolding fell on deaf ears. As she put it, as you can imagine, none of the other health professionals I worked with would acknowledge that things were strange. It certainly has been a lonely journey. Strange, my friends, would be an understatement for these past 3 years. And that, my friends, will bring our episode to a close once more. For For more content like this, be sure to check back to this channel daily, Monday through Friday, or for written articles published every day, 7 days a week, feel free to check us out at trialsitenews.com. And as always, my friends, thank you so much for joining me on the program today. From Trial Site News, I am Adrian. I will see you all next time.